is this your experience? Okay. If they have a high AHI, that puts them into sleep apnea categories. The whole point about upper airways resistance is that they have a normal AHI. They don't have sleep apnea. So that's actually different pathology in terms of the line in the sand. But upper airways resistance syndrome is still pathological. So yeah, absolutely from that point of view. And then especially in kids. And look, I'm happy to be shot down by those that want to shoot me down, but I really don't think that the research supports sleep studies in children in terms of differentiating who needs treatment and who doesn't. The thing that differentiates things is their symptoms. Do they stop breathing at night? Yep, all right, they need fixing. Do they have concentration problems, behaviour problems, learning problems, nighttime disturbance, waking up tired, ADHD-like symptoms? That to me is the clinical picture, and I treat kids clinically. I occasionally need sleep studies to justify certain interventions because some of these interventions are pretty fancy, and you sort of want to feel that the kid is bad enough that risk is justifiable. So in that context, the sleep study will help. And some kids just don't fit the bill. You look at them and their airway is absolutely perfect, but they've clearly got a sleep problem. Sleep apnea and airway problems are not the only category of sleep problems. There's a whole range of other sleep problems, and that's where the sleep study clinics really come into being. And that's partly why I like to not overwhelm the sleep clinics. I think the sleep clinics need to be there for the complex cases, the unclear cases, the cases for clarification. A child comes in with, markedly blocked nose, big tonsils or whatever. I get the parents to bring in some video. They show me the video, and a minute of video, I see that kid snoring heavily and stopping breathing. I don't need a sleep study to know that this kid's got a problem. It's right there in front of me. So that's probably more how I would go along with things. Okay, so next question we've got is from a GP about antibiotics for sinusitis.